In terms of how, I guess, common they are, how prevalent are they in the general population of people?
Well, they're relatively common. I think that if one wants to look at illnesses as such, where a person has a significant amount of distress, difficulty in functioning, and a clear symptom picture, the schizophrenias would probably be in the 1 out of 200 population. Mood disorders like bipolar disorder are also similar, 1 out of 200 or so. Depressions are about 5 out of 100. Psychotic depressions being about 10% of depressions, again, about 1 out of 200 persons with a psychotic depression. And as we go into dementias, for example, we find that as one gets older and the incidence of dementia increases, so does the incidence of psychotic symptoms at that point.
You mentioned age. Is there a specific age of onset in terms of all these disorders?
Most psychotic symptoms that are internally generated, like the schizophrenias, bipolar disorders, and so on, will tend to start in late adolescence, early adulthood. Sometimes it can start a little bit earlier. My experience is that it's a relatively rare event to start, before the age of 10, before the age of 15, but it can occur. And these illnesses can also start a little bit later or a late onset illness. I think according to classification systems like the DSM-5, for example, now we don't talk about the upper limit so much. We used to talk about an upper limit of 45 years, but we have fewer people that will have a beginning of a psychotic illness after the age of about 40 or so. A much smaller number.
In terms of gender, does it affect males more than females?
It tends to be something that affects males more than females. Depends on the study that you look at, but I think most studies now would suggest that boys are a little bit more susceptible to this than girls are.
Are there any types of predispositions that people have in general that lead them?
Yes, we know that psychotic illnesses as such have a certain genetic basis. It's not the whole story by any means, but in a large European study looking at the genetics of psychotic symptoms, there were 108 genes, 108 genes, that were found distributed amongst schizophrenic family of illnesses, bipolar disorder, major depression, even autism. And so that there's a wide number of genes, a wide number of possible combinations. So nobody really has the same illness. And this is true, I would say, also for depressions and bipolar disorder to a certain degree. So we know the genetics are there. We know that there's a heritability factor that is clear from family studies. That is to say, if you have one parent that has a psychotic illness like schizophrenia, your chance of having the illness would be about 10 to 15%. If both members of the family had a psychotic illness, both parents that is, then your chance of having a schizophrenic type of illness would be 40 to 50% or so. So it's not completely genetic like brown eyes or nose shape or things like that, but there's a heavy genetic component. In other things that involve or influence psychosis, we know that difficult birth, not necessarily difficult pregnancy, but difficult birth with probable hypoxia, or that is lack of oxygen, will increase the risks. So we'd call obstetrical hardship. So a premature baby, a baby with a high forceps delivery, a baby that has to be resuscitated. Of course, the majority of these children will not go on to develop a schizophrenic type of illness, but it certainly does increase the chance, and it increases the chance of having the illness a little bit earlier. We mentioned that the illness can be maybe not caused as such, but certainly accelerated or precipitated by the use of drugs, particularly marijuana. So those are outside factors. Another factor that is of interest is that people who are immigrants will have a higher degree of or high risk of psychosis. It is thought that there is a kind of normal adaptation to the environment around one, the new environment, the new society, with a little bit more suspiciousness of how one is going to be accepted. But this tends to be somewhat diminished. Nevertheless, we do see it.